Good evening. I'm Opara from FHI 360, Nigeria, and I'll be presenting on behalf of my colleagues who are not available to make this presentation. So whatever questions...
Page 14.
Whatever questions you may have, I'm just trying to put out a disclaimer. I'll do my best to answer. All right, so this study basically examined sex differences in uptake of HIV services in Nigeria. So we basically reviewed HIV service data from patient records, from about 242 supported sites. We actually supported by USAID. So we reviewed data from September 2008 to August 2011, so it was a 3-year period. So we're basically looking at some indicators and looking at the sex differences in terms of utilization of services, like HIV counseling and testing, positivity rates between males and females, enrollment, and ART start. So we looked at 2 groups. We had those less than 15 years, the pediatric group, and those above 15 years. So basically, what we found was that in terms of utilization of HTC services, we had about 52% of males accessing services, which was actually surprising. We would have thought it was the other way around. And we had 48% for the females. Now, in terms of positivity rates, it was double in the female population compared to the males. So that's about 16.8 to about 8.5. And there are really no differences in the pediatric age group. Most of the differences were seen in the adult population. And then for all other indicators like enrollment and ART start, we could see that for the females, it was double in terms of uptake of services compared to the males. Now, in terms of enrollment, looking at number of individuals enrolled in care, we had about 15,975, out of which we still had double in terms of females being enrolled in care compared to the males. The mean age at registration or at enrollment was about 39 for the males and 32 for the females. For the baseline CD4 value, we also saw some significance in terms of the values for males and females. We had the males having lower baseline CD4 of about 129, and then for the females, about 161. And also for the staging as well, you could also see that the males showed more advanced disease when stage 3 and 4 compared to the females. In terms of outcomes, we also saw that the males had poorer outcomes in terms of loss to follow-up and deaths. So you had statistically significant values for those 2 outcome indicators that we looked at. So in summary, would say that what we noted from this review was that there are sex-dependent differences in HIV positivity rate like we saw, uptake of HIV testing, enrollment in care, and disease outcomes as shown. And not surprisingly, we did expect to see that the women would utilize the services more. We know that generally women are believed to have a better health-seeking behavior. What we expect to do is conduct qualitative studies, which will further help us to explore the whys as to specific vulnerabilities, barriers to accessing care, because we want to know why are the men not accessing care as much as the women are. I know that's the $1 million question. Yeah. So in summary, I've already seen the 1 minute indicator. We want to see a situation where design and delivery of HIV interventions will take into account these differences. How can we make the HIV interventions more attractive to the males? What can we do to get the males more interested in their care, like we have for the females? And that way we can plan and design and deliver HIV services in our Nigerian setting. Thank you very much.